Hello, I'm Renee Hinkle. I'm one of the founding physicians of Cheyenne Women's Clinic. I decided to go into women's health care mainly because I enjoyed women patients. I connected with them in ways that I didn't connect with a lot of male patients. And OBGYN is a fabulous career path because you're able to do so many different things. You see patients from early adolescence up through elderly women, and so you get all of the different life stages, and so you get to see women when they're having babies. You get to take care of women as they get older and get into the menopause years and deal with all the different variations of the stages of life, and it really makes for a varied practice of medicine, and so it's never the same thing every day, and that's what I like about it. I like being in the office and having patients that I've seen for the last 20 years, but I also like being at the hospital and being able to do deliveries and bring life into the world. I enjoy surgery, and so it really is a great mixture of all the different parts of medicine, and that's one of the reasons I really like it. Again, the best parts of my job are the patients. Dr. Story and I started Cheyenne Women's Clinic in 2004, really just to try and give a little bit more personal attention to our patients, to be able to offer them the best possible care in Cheyenne. And so we've really worked hard to try and bring the best possible medicine to the women in Cheyenne, and we really enjoy it. We've gotten to know our patients. I still see patients today that I started with 15 years ago, and it really is rewarding to be able to be with patients for that long and to make it a personal relationship as well as a patient-physician relationship. And so that's been probably one of the most rewarding parts of this job and of having this clinic and being a part of it. The employees that we have been fabulous. We really try and put the patient first. We really try to keep them as the focus, and then that has really made the work worthwhile. My philosophy about women's health care is to treat each patient individually, to really work with each patient regarding their problems and come up with a solution that works for them. We don't have any one ideal of exactly how to treat a patient, whether it's an OB patient or a menopause patient. So we try to make each patient feel like they're getting their own individualized care, whether that's we do hormones or we don't do hormones, whether that's they want to have epidural with labor and delivery or they don't want to have an epidural with labor and delivery. Each patient gets to kind of choose how they want their care to go, and I think that's one of the philosophies that we have at Cheyenne Women's Clinic, is that each patient is individual, and so we get to treat them that way. When I'm not working or on call, I've spent about the past 10 years following my kids around. I have 2 daughters, and so I was a swim mom for years, and I've been a soccer mom for about the past 10 years. She's just graduated, and so I will have quite a bit more time to do other things. I enjoy traveling. We've traveled to Croatia and Ireland, France and England over the past about 6 years. And I really enjoy that. I lived in Italy for 3 years when I was in the Navy, and so I think that's what helped me get the travel bug. I also love to cook. I love to try different foods, and that's one of the reasons traveling is fun, because I get to try out different foods in different places and then come back and try them out at home. I've also kind of gotten into hiking lately. We did quite a bit of hiking while we were in Ireland, and spent a lot of time hiking the last couple of summers here in Wyoming. Hoping to go down to Colorado a little bit more and do some more hiking this summer. I work out daily, and so I've been doing things like HIIT 30, high intensity training. I love Zumba and things like that. So I do enjoy doing things like that, and spending time with my kids. It's one of the biggest joys.